Hey, Tommy.
What's going on, Stacy? How are you?
I'm good. How about you?
Thank you so much for joining me. I appreciate you making the time for this.
Glad to be here.
Absolutely. So I'm going to give you an introduction, but I'll let you introduce and tell a little bit about yourself. So this is all an ACL graduate, Stacy Otremba. She is a newly minted black belt in karate, longtime martial artist, two-time ACLer, one-time all in ACLer, someone who did absolutely amazing with us. Really got into strength training through the process of this recovery, came back truly the definition of when we say stronger than before. It is no exaggeration in Stacey's case, and we have the numbers to prove it. So I'll let you start off. Just tell a little bit about yourself. Your history as a martial artist, your history. With your first knee injury and kind of where that led you to starting with us in the second one.
Yeah, so thanks for the introduction, Tommy. Actually, you did a really good job introducing me, but to kind of spring off of that, as Tommy said, I'm a martial artist. I've been doing karate for about 8 years now. I did kickboxing before then. I was a college fencer, so kind of longtime athlete, pretty active person. I'm a runner, hiker. I'm always doing something. I've got a little hobby farm, so I'm always doing something like on the farm and everything too. But not really a gym person, but otherwise like really active. Wasn't a gym person until I actually, got with Tommy and started doing all in ACL. But a little bit about my first injury. That actually happened in February of 2019. And basically, I was at a karate tournament and went to throw a roundhouse kick, and suddenly my knee just went out from under me. It was nothing dramatic. It wasn't like some sort of dramatic story that I was in like excruciating pain, like there was this crazy pop. I just fell down and I got back up again, and I didn't really think that like anything that bad had actually happened. My knee felt like a little bit unsteady. I was given about like 30 seconds to decide if I wanted to continue the match or forfeit. And I chose to continue actually, and actually won my match. I think this girl
Let's
thought that I was like so
go.
crazy. Like I was just in there like throwing hands and everything and limping at her. I think she thought I was so crazy that I ended up winning. But then like I had like another instance of my knee kind of going out. And my coaches told me that I really needed to forfeit at that point. I didn't want to because my next match was for gold. So I took silver by default. But again, like I didn't really think anything was wrong. I just thought that I tweaked something and a little bit of rest and I would be fine and back on my way in like a couple of weeks. So I rested basically for a couple of weeks, did compression, didn't see a doctor, just walked around on a torn ACL for a few weeks. And I tried going back to karate because it was kind of like feeling better. Like I got like my flexion and everything back. So I tried going back and the exact same thing happened. My knee like went out from under me and I was like, well, crap, like I know something's wrong at this point. So I went and I got my MRI and turned out I had a full thickness ACL tear, a near full MCL tear, and I had meniscus damage as well. So at that point, I went ahead and scheduled surgery like for April of 2019. And I don't know if I mentioned or not, I am a healthcare provider, so I did like a little bit of research and stuff like on my own before I went ahead and scheduled my surgery. Like looked into stuff like prehab, went in with a lot of questions and stuff like to ask. Um, and did my research on like PT and everything. Asked about prehab, but it wasn't like really recommended for me, so I just figured I might as well just schedule my surgery right away and like get it over with as soon as possible. I did find out that I needed to have like full flexion extension before going into surgery, so I just kind of rehabbed on my own and was able to achieve both of those before I went in for my surgery. And my surgeon was really great. He's like well known in the area for treating like athletes, like pro athletes and everything. So I really felt comfortable that I was in really good hands, like with my orthopedist. He was insistent that I got get into physical therapy on post-op day one. So I went ahead and did that. And when I went to kind of research my PT clinic, I was given like this whole list of local PT providers to choose from. And I ended up choosing a PT clinic that was actually affiliated with the sports medicine program. It's actually inside an athletic club. And when I walked in, like I saw like this giant club and it had like access to weights, a track, like a big Olympic sized swimming pool, even like a boxing area and everything. And I saw other athletes that were actually like in the clinic too. Like it wasn't like just some geriatric clinic or something. Like I felt like this is the place that I needed to be. And I said, great, like this is what's going to get me back. And I felt like really confident kind of at that point on day one, like with my physical therapy. when I met my PT, what she was telling me kind of like aligned like with my research and expectations. She told me that it was going to be like 9 to 12 months and kind of like outlined a timeline and like milestones that I would have to meet. We did talk about like strength testing and everything too, and my progression like onto like the weight machines and everything. So again, like aligning like with my own research that I thought I was going to do really well in this program. And actually, as I went through the program, I just kind of like flew through it. Like I met like all of my early like milestones. My flexion extension, I got back like basically right away, like within like the first week or two. Everyone just kept saying like how great I'm doing. I my gait normalized like pretty quickly. I wasn't limping. I progressed like off of crutches. Even though I was in a brace like for a little bit of time post-operatively, because of like my MCL tear, which is not surgically repaired. I did have like a little bit extra time in the brace, but my PT was pretty liberal, like with taking my brace off and letting me work without it, like within the clinic. So I never really had like a big problem like with like my gait or anything. We got on knee extension like pretty quickly, got on leg presses and everything like pretty quickly. And before I knew it, we were already like kind of talking about like my jumping progression, my running progression. This is like around like the 12 to 16 week like post-op period that I was in. And she did strength test me because I was doing like knee extensions and everything, and I hit my 80% symmetry at that point. But the key here, and we'll kind of probably get back to this again, like further in my story, I was only strengthening one side, so just like my right leg, my operative side. So in the end, like I ended up being like no stronger than I was like when I first tore my ACL. So I think that was kind of like a key and like a big miss like within
Mhm.
my rehab was like not having that other component of the strengthening.
Yeah. And I'm going to pause and I'm going to let you pick right back up where you were in the middle of the story.
Mhm.
But I just want to give for some people who've just joined and are maybe just finding out about Stacy's story. So Stacy tore her right ACL back in 2019. Eventually, after coming back, going through what she thought was very good rehab and what was, very good for traditional in-person session-based rehab was, really very good, right? Left her feeling like it was really good. When we first talked, I remember she was like, this was, I did my research, I did my homework. She's, a pharmacist, obviously, used to reading research, used to, knowledgeable healthcare provider, did her own research, found what, I would consider very good traditional in-person PT, did really well with it, flew through a protocol, and ended up suffering a tear on the non-operative side, which is something that we often see and something that people don't really are aware of. There's a lot of scary statistics in ACL rehab, but one of the things that people don't know is there's a paper that shows after you've torn your ACL, you are twice as likely to re-tear that ACL, but you're actually 5 times more likely to tear your non-operative ACL. And one of the reasons for that is we've seen in studies that you lose about 20% of the strength of your non-operative side over the course of a long rehab. And because of that, we see people not only putting themselves at risk on the surgical side, because now you're using symmetry numbers that don't necessarily compare to you might be comparing what we colloquially call two flat tires. But then also you're putting yourself at risk by losing strength on that non-operative side that may be taking more of the load. So I just wanted to interrupt there, kind of give a little bit of background of where this has headed. And obviously,
Yeah.
Stacey started with us on that second injury, and had obviously a very different rehab experience. And we'll talk through that here. But I'll let you pick up kind of where you were at about 12, 16 weeks
Yeah.
on your first recovery, getting back to, passing your strength testing and starting jumping.
Yeah, yeah. Thanks for the insight on that, Tommy. So yeah, I went into my jumping progression, and I'm gonna say I had very few red flags like within my PT, like my first rehab. One of them like may have been jumping, but honestly, I was never a jumper like even before my ACL rehab. And so when I had like that hesitation about like starting my box jumps and everything, I honestly assumed that it was just me and not a reflection like of my rehab. And I was like, of course, like I'm scared and this doesn't feel good to me because it never felt good to me. So that was kind of like the only like really red flag, and I did just the bare minimum of jumps, like just to kind of like get progressed through and go into my running, which is what I really wanted to get to at that point. I actually, before I tore my ACL, I had a big half marathon like kind of set up that I was like kind of like pushing towards trying to be able to do, and it was scheduled for about 7 months post operatively. And so I was like kind of like pushing myself, like getting ready like for this marathon. It was a big thing that I wanted to be able to do, especially after the ACL injury. I wanted to be able to prove myself. And so I actually did end up running it, and I actually did great. I set a course PR for myself. Um, I didn't have like any issues like with my knees, like no swelling, like no pain or anything. So again, like no red flags. Like I felt like I was just flying through this and doing like really well. So then kind of like to go on, I was still, feeling pretty optimistic. The rest of my rehab, like we kind of started doing like more sports specific stuff, like trying like kicking, because like there's a boxing gym and like all of that was going okay for me. And then, I finished my 12 months of rehab with my in-person PT, and I was getting ready to go back to karate, and then the pandemic started. So again, as a healthcare provider, karate, the gym, my knee was the absolute last thing on my mind at that point. So I spent about like 4 or 5 months basically doing nothing with my knee. I stopped running. All the gyms were closed. Karate was closed. So I didn't pick back up again for about like 4 to 5 months later. And then when I went to go back to karate, it just felt like I had like a dead weight that I was like dragging around on my right side. I didn't like really feel confident. Like I felt like really sluggish, and that was kind of like my first inkling, like that something was missing like from my rehab, and I didn't get back to like 100%. I don't know if you want me to go on from there, Tommy, or.
Yeah, no. So honestly, I think you should take that right into then that second injury, and that was kind of okay. You're starting to have this, but yeah, talk to go right through that second injury, and then kind of starting rehab again, and really how you found us.
So yeah. So after I went back to karate, I mean, like I push like very hard. Like I'm not the type of person that like gives up or stops trying. So I felt like I was working like probably 2 to 3 times as hard as my teammates. So I just kind of like kept pushing through it, and I was like, well, I just need to work harder. Like I just need more time. And I really felt like I was still going to like kind of get back to it. And eventually, I sort of did. I got back to doing tournaments, and I was doing very well in the tournament circuit. Routinely like doing well like in my matches and my fights. I was passing my belt tests because I was still an underbelt at that time. Passed my Bodan test, which is the test where you become like a black belt candidate. Did great on that. And once you become Bodan, then you have about 6 months before you end up like testing like for your black belt. So I started going through it's like this really intensive boot camp training session where we're working out like 4 or 5 days a week like with our teammates and everything as we get ready to test for black belts. And about 3 months into that, I actually suffered a second ACL tear, and this is on my left side. Um, so, I mean, that was like really devastating to me. Again, like the very same like anticlimactic thing happened. My knee went out from under me, but I knew exactly what it was at that point. I talked to several like healthcare provider friends, some orthopedists, like before I ended up going to the doctor, and they're like, "Oh no, like your ACL is like not torn, like you've got pretty good stability and everything." I was like, "No, like I felt it,
I
like
know
I
this
felt like my
feeling.
femurs collide, like I know that feeling." It's something, if you've experienced it, like that feeling, even if it didn't hurt, like you will never forget it. And so it was no surprise to me when my MRI was read to me and I found out I had a second ACL tear there. Um, so at that point, I was starting to look around and like do more research because I was like, obviously something failed me like in the system, and I'm trying to like kind of figure out what. I thought that I had pretty good like in-person PT rehab because my PT like she really tried to make things work for me. I felt like she tried to give me like the best chance that she possibly could. So absolutely nothing against her. She would let me come in like half hour early, like to warm up before my session. We would have my 45-minute session with her. She would let me stay like another half hour, 45 minutes, and I'd do my weights after that. I think the clinic staff were like very annoyed with me that I was like there for like 2.5 hours for my like 45-minute session. And then like she also gave me like I had like a mobility program and stuff like that I did at home. So I was like, like something is not aligning here. Like I need to do something different. So that's when I started like doing more research. And again, like I was kind of shocked like that I had like the second ACL tear because I wasn't expecting it. I felt like as a healthcare person, like I know the system is difficult, but I also felt like I knew how to navigate the system and advocate for myself. So it was surprising to me like that I was the statistic and that I didn't do well. And, I was familiar with some of the ACL data out there. And again, like my assumption that like these poor outcomes were because of perhaps poor adherence. Again, like knowing how things are with patients, there's a lot of barriers to being able to comply with a program like 100%. And I was like, well, I just need to do things like 100% and like be disciplined and work hard. And I felt like I was going to get through it. Um, and again, like kind of like that martial artist mentality, like yeah, just have to grit your teeth and be disciplined and like get through it. So it was really surprising to me that I had the second ACL tear. Um, Back in 2019, like there's very little like ACL presence on Instagram. Like Instagram wasn't really like being used like for businesses back then. Like we were just sharing cool photos and everything back in 2019. Accounts like Tommy's
Well,
like really weren't around, and I was really looking to like at that time. I was trying to find like it's a very isolating injury, and I was trying to find like other people, especially like martial artists, like that had like my type of injury, because I felt like very alone and like I was the only person that this happened to. So I literally had been scouring Instagram like for a very long time before like Tommy made his account, and there started to be like a bigger ACL presence on Instagram, and so I followed Tommy. And he reached out to me, and we started chatting like a little bit. This was after I knew that I tore my ACL, but before I had my MRI was kind of like when we started chatting on Instagram. And I honestly wish that I would have like reached back out to Tommy like immediately after my MRI. But I kind of went ahead and just scheduled my surgery before I did that. So Tommy and I didn't actually end up starting to work together until I was about like 6 weeks or so post-op. So I kind of missed like some of that early like rehab with Tommy. But I in that time period, like I was still kind of like doing my research. I follow a ton of ACL people like on Instagram, so I was doing a lot of different research, and I actually ended up having I think about like 6 different interviews with different ACL rehabbers, just trying to find like the best match. And like when I Tommy was actually the very last interview that I had. And I was like, all these people are great. Like they're super qualified, like really know their stuff. But when I reached out to Tommy and like we had our initial phone call and our conversation, I felt like Tommy gets me. I felt like it was like the first sense of relief I think that I had had like since my injury, because I felt like I finally saw like a way out, like out of this tunnel. I had finally been shown the way.
yeah. Yeah, I first off so appreciate that. I remember back to our first phone call, and as someone who's like, it's so funny. I think uh some people, like you said early on when I was on Instagram on in the ACL world, there wasn't this huge ACL presence, right? It was me and just a few other people. And
Hmm.
now there's a lot more people doing it. It's kind of become a thing, right?
Yeah.
And I think sometimes people shy away from that. And I think it's great that there's more and more people out there. And I am the biggest person in the system of saying patients and ACLs should advocate for themselves. They should do their due diligence. And I remember when we talked, I love that you talked to 6 people, right? That tells me this person's really committed. They're going to put in the work. They want an outcome, right? And they're going to do everything possible to achieve it. And I remember our first conversation. I remember uh, feeling like, and I'm glad you said this about, your first PT really did their best, right? And really did right by you. And that's one of the things I always say. I used to be that person in the clinic, right? Who was like trying to go above and beyond for patients, right? Of
Mhm.
letting you come early, letting you stay late, trying to build you a program during your session, right? And I think a thing to recognize in that is what's hard in that, and why we kind of took it to this model. And for those who don't know, but most people do know, all in ACL, we operate just outside New York City, but we only work with ACLers. We only work through this model. And we really believe in this online model because, and we'll talk through this a little bit, what ACLers really need is a program, right? When we talk about all the different buckets we need to fill, from load management to swelling management to strengthening your non-surgical side, strengthening your calf, which plays a huge role in secondary prevention, and then the more obvious things like quad strength, hip and hamstring strength, range of motion. But that is really hard to cram into a session, right? And then it's also really hard when your job as a PT is sessions and operating sessions. Even if you're giving your best and you know your stuff and you're strength testing and doing all the right things, it's really hard to provide someone to sit there and map out a program, right? Because you're doing sessions, that's what you're running, right?
Mhm.
So talk a little bit, and I'm getting ahead of ourselves here, but talk a little bit about what you found with this model that, was really obviously the difference with all in ACL, but also with this model specifically compared to, well, maybe I just need to try an even more reputable in-person local PT.
Yeah, so the model I felt like it was honestly even more personalized to me. I still felt like I was just part of like a generic protocol, like compared like with my other ACL like rehab program in person. And with you, it was like very much customized to me. So I felt like this is my program, like this is for my knee, like for my issues. Um, Number two, I would say like the big difference was like the time commitment. I was spending so much time like in that clinic. It was like it was really hard. Like I had to have people like help me so I could like make it to these sessions. Like I was like leaving work constantly. I was having to have like people pick up my dog and everything and like drop off dinners and stuff because I was just at the clinic like all the time. So it was like a humongous time commitment for me. Versus like when I switched to you, Tommy, and I started doing my rehab with you. Like don't get me wrong, it is a time commitment, and you will have to make that time and prioritize you like to get it in. But we're talking about like, 45 minutes like to an hour a day versus like, 2, 3 hours and driving and like back and forth and everything. And it's an hour of time that like you get to choose like what time it is. So to me, like anyone like with a job, like with kids, with other stuff like going on in your life, that's probably going to be much more sustainable versus like a year of like 2 to 3 hours a week, 3 times a week.
Yeah. I'm so glad you said that because it's funny. Like, I always talk about, hey, this requires a time commitment, this requires an investment in that time. But I think something that gets overlooked a lot is because we do this custom, we really do save you a lot of time.
Mhm.
And I've seen that too, where, hey, you end up giving someone, well, every stretch that we give every ACLers, right? And, calf stretch, hamstring stretch, hip stretches, and then also all the right strength program and things like that. And then bend walks and leg lifts. But because we test and we customize to you, we're cutting out that superfluous things that you may not need, right? And that actually saves you a
Mhm.
ton of time. And I would have said exactly what you said. Don't get me wrong, it takes time, right? 45 minutes to an hour a couple times a week, almost every day, that adds up. That's a lot of time, but it's nowhere near, 3 hour session is a red flag that, hey, this isn't custom to you, right? We're throwing a lot
Right.
of different things at you, because you're not going to be able to sustain working different muscle groups for 3 hours
Right.
properly.
Right.
Um,
And the other thing, like going back to the wasted time. So during like my second rehab, actually the day that I signed on with you was like kind of like my worst PT session that I had. My PT during my second time, she was dealing like with a lot of stuff and was out sick frequently. So I
mhm.
kept having this fill-in PT, and I was like weeks ahead, like on my program and everything. And she kept trying to just get me to lay on the table and like work with the bands and everything. And I was like, no, like I don't do this. Like I do the knee extension. Like I got to go out there and
Uh,
like do my leg press. And she just gave me like this super generic exercise. And that day, like I felt like I could just be doing this myself, and I didn't actually need to go there and waste my time and waste like my co-payment and everything too. It was like, and that
yeah.
was the day that I actually called you back, Tommy, and we ended up signing up. So
Yeah.
yeah, I,
No, and I think that's, go ahead. What were
I
you going to say?
gonna say like I had some hesitancy like about like the remote like coaching and everything, but that was like kind of like the nail in the coffin there,
Uh,
where like I wasn't actually getting like paid attention to. I realized like as well as I thought I was like in my inpatient rehab, like she was double booked with another patient. She barely saw me like the rest of my session, and I was like, well, like he'll at least like see my videos, like there's something. So that's
yeah.
when I started to feel comfortable.
Yeah.
So I realized I wasn't getting that personalized attention that I thought I was getting.
Yeah. Yeah, talk a little bit more about those hesitations, honestly, because again, same thing. I don't shy away from them. I
Yeah.
know, this is new, and now, we have literally hundreds of testimonials. So now it's a little bit more like of a proven method that people would, when you were signing up, we had people, right? We had, following, but it wasn't near what it is today. And, we're grateful for people like you who've gone through it and kind of shared their experience. But talk a little bit about what some of those hesitations were and how they, were dispelled for you. Because I always think that's really good too. Of like the first thing people used to ask us, back in your day when you started with us was, how are you going to monitor my form, right? And that's always then something that people are like, we'll start with us way down the road. And it's like they get form corrections they were never getting during their recovery. And we put out more content now of showing some of our form corrections, but talk a little bit about, what were some of the things that really you were hesitant about, and then kind of how it ended up being the case or being not the case.
Yeah, so like I signed up with you in 2022. So like at that time, like it was very weird to just say that like I found my physical therapist like on Instagram. Like that was a weird thing.
Yeah.
You know, it's very non-traditional to how I would have found like a PT going like going forward like in the past. So getting over that was one thing. And again, I think my biggest hesitation was like how I was going to get like the form corrections and everything. But I just kind of scrolled through like your Instagram and everything, and I was able to see like the form corrections like that you're posting for people. And I think I did talk to one or two other like all ACLers like before I signed on or like shortly after, and they kind of said like the same thing. And I watched some of the testimonials too. So I felt a lot more comfortable after that. And again, like during my first rehab, I did have like a little bit of like a remote like component because like I did have like this little app that my orthopedic surgeon had, and they
Mhm.
would program like mobility and stuff in it. So I was already somewhat like used to following like the app and doing like an app-based like program
Yeah.
and everything. So it wasn't a big leap for me.
Mhm. Talk a little bit about, and you touched on this a little bit earlier, of like, hey, I'm a longtime martial artist, but would not have considered, runner, but would not have necessarily considered myself a gym person, a strength training person, prior to going through this with us. Talk a little bit about how, despite spending, 3 hours, at rehab, and, not really considering yourself a gym person, maybe having hesitations about starting with us, which we're very upfront that we encourage people to get in the gym, but obviously we're not there with you, right? Talk
Mhm.
a little bit about how that worked for you, being able to get into the gym despite not being a gym person.
Yeah, I'm not gonna lie, like it was like a little bit like there's that intimidation factor, like when you first like walk into the gym and not being a gym person before, like there's all these machines, like which one is mine? Like, do I know how to use it? Like, do I know how to set it? And like I'm already like kind of like making a scene like coming in because I've got like like the knee sleeve and everything like on. So I think like there is a little bit of like hesitation that you just have to get your feet wet and like get over getting into the gym. So my first session, I'm not gonna lie, like it was like pretty tough. Like I didn't find that I circled 3 times before I found the machine I needed. Had to ask somebody like to help me like set it up. But honestly, everything after that like got so much easier. So you just have to like get through kind of like that first session. It'd be the same if you weren't rehabbing. Any time that the first time you set in a gym, there might be
Yeah,
some of that hesitation, but
yeah,
just going there like assuming like most people want to help because most people do. They either want to help you or they're not paying attention. So
yeah, yeah.
it wasn't really a big
And I
deal.
think, and I think that's a great point of like one of the things I tell people that really becomes critical, and I think is really critical for this is like we have systems set up to help people who are not gym people become gym people or get through the what they need to do done, get what they need to get done in the gym. And what I say is, if you're a hiker, a martial artist, a dancer, someone who says, hey, I'm into fitness but I like classes, I'm not really a strength training person, the path back to all of those things goes through the gym.
Hmm.
Whether you go to in-person PT or not, you are not going 4 or 5 days a week. You're certainly not even going 3 days a week for the duration of your rehab. So you are going to need to get in the gym at some point if you want the level of success that someone like you wants. We have systems set up where we can give you more guidance while you're in the gym than you would get on your own, no doubt. And that is, I think, where the sometimes disconnect, like, you really are still going to need to go in there, but it's better to have, the videos we've created, the plan that you understand, the program, specific sets, reps, intensity. And I think that really is something that I think is a little bit misunderstood, that I think, your experience really speaks to.
Yeah, the videos were so helpful. I forgot to mention that, but like there's on the app, like there's all these like videos and everything, and like you can actually like see Tommy like doing like the different machines, and everything. So it was like a lot less intimidating versus like having to figure it out like yourself, like from scratch, like going in there. So,
Uh,
and Tommy was like very like you were very upfront with me, on our first like phone call, and he asked me if I was a gym person, and I said no, and he basically said, well, you are now.
yeah.
And so I
Um,
really took that to heart like after that. So.
Yeah. And I think that's one thing that we really try to pride ourselves on, being honest. And like, this is no bias on our end, right? Because we do this completely custom. We can build this, back then, during sometimes the COVID days, we would build people no gym programs, right? When they couldn't go into a gym. A lot of places had lockdowns, even longer. And then still, we build people no gym options all the time if they truly can't get in. But I will always tell people the best results you're going to get, whether you're working with us or not, is you need to join. Getting into a gym is going to get you the best, fastest, safest,
Mhm.
most long-term results. And I think that's really a key thing. Uh, Talking about that, let's skip ahead. Now we'll go through, we'll kind of go back and we'll skip around, but I think it's helpful. Talk a little bit about the results you've seen just from a becoming a gym person. The feelings you've had, the strength you've gained, what you felt like when you got back on the mats, because I think
Mhm.
those are really, one of our, I don't want to say like buzzwords or key words that we really use is empowerment, right? And that's what I really view this as, is empowering you to become a gym person, to get done what you need to do, to get back to what you love, right? So talk a little bit about that.
Yes. So I think I'm going to preface like the strength training like just by saying this, that even if you're not an athlete, even if you're not going pro, or like even like a semi-pro athlete, or even amateur, being strong and getting in the gym and strength training is going to make literally every other aspect about your life easier. And you're going to notice that. So even like before, like I got back on like the mats and everything about my life got easier once I started to become strong. If you have to go to Costco and like pick stuff up at Costco, life is easier. Like you're not waiting around like for someone to load stuff into your car anymore. I maybe have kids. I don't. I've got an elderly dog that I need to help out. I lift my 60-pound dog easily into my car multiple times a day. And I don't know what I would do like if I wasn't strong enough to be able to do that. So that strength training, like especially like for someone like in your 30s, like it's kind of time to start thinking about strength training and what you're going to do, like so that this is sustainable for you, like for the rest of your life, whether you're injured or not. It's kind of time to start thinking about that, like in your 30s. But like, also like that being said, like going like back into karate and everything and back into martial arts, it improved like basically all aspects like of martial arts for me. My kicks are stronger. Everyone was commenting once I started like, because when I was with Tommy, I was really just doing like lower body stuff. Like I wanted to do upper body, but I just was having a hard time making that time commitment. But I started working with the trainer after I finished my rehab with Tommy, and started doing like whole body strengthening and everything. And everyone just kept commenting like how strong my punches and everything were. I was able to pass like my push-up portion of the black belt test, and like I wouldn't have been able to pass that if I hadn't like seriously devoted some time like strength training. So it's
Yeah.
literally it's improved every aspect of my life.
Yeah, I love that, and I love everything you said, and I think that's something we say all the time to people. Like, the people who have this injury are generally, and the people who work with us generally 25 to 45, right? And there's people a little younger, a little older, right? But 25 to 45. And what we always say is exactly what I said, what you just said, of like, hey, if you were wanting to continue doing karate, when you're not just 30, but 40 and 50 and, even 60, strength training is the way you're going to be able to continue to do that. And that may sound obvious to people who don't compete in martial arts, but it's surprising how many martial artists don't strength train, right? And I
Yes.
should have said this earlier, but I do Brazilian jiu-jitsu myself. I'm not a black belt, like Stacy in karate. But I always say this, that when I started jiu-jitsu, the people who said, okay, I used to work out and now I'm going to do this instead, because it's, let's be honest, it's, class, it's competitive, it's more fun, right?
Hmm.
It's a sport. It's more fun to get outside and go for a hike. It's more fun to, get in the gym and spar. It's more fun to go skiing than to, be in a gym and work out. However, those are the things that allow you to continue doing that. And I always say the people who started jujitsu when I did and stopped strength training are the people who ended up not being able to sustain it because they kept getting injured. So thinking about strength training is not just performance in the way you've described, but also injury prevention and things that are going to keep you doing the things you love for a long, long time. And I think that's one of the things we really talk about is viewing this year of, hey, this is going to be a year-long commitment of you going through this injury as a time to prioritize your health and learn skills that you're going to grow in the gym, that you're going to take with you for the rest of your life. And I think exactly what you said of like, hey, now I've hired a trainer, I want to expand that into my upper body, but A, you have the skills to continue maintaining if you wanted to do it on your own. And then B, you have the freedom, right? I always say that too, of like, it takes, an hour a couple times a week, right? But we don't expect you to maintain that, right? We want you, I always say the bar for maintenance is much easier than the bar for getting fully rehabilitated, which when you achieve that, it's much easier to maintain it. And that gives you the freedom to then say, hey, I'm going to spend more time on the mats. I'm going to spend more time, working my upper body. I'm going to spend more time in my garden if I want, all of those things, it, absolutely gives you the freedom. And I think that's really, really important.
Yep. Yeah, absolutely.
Um, One thing I want to do, and I'm actually going to turn to my computer. I usually try to write these things down, but for you, we have such an abundance of data here that I was looking at that I was like, I really want to just have it in front of me and refer to it because when we look back, it really shows the growth of where you're at. So I went and looked back at what your first strength test was. So this is April 2nd of 2023, and this is a couple months post-op,
Yep.
and your left side is 110 pounds and your right side was 150 pounds. It's on the knee extension machine. As we progress towards your final strength test, your left side, so is your former surgical side, now are viewing it as an op, was 215 pounds, and your surgical side was 220 pounds. So just an astounding, more than 25% growth in just comparing your non-surgical side and previous surgical side. Obviously, more than 100% growth on your surgical side, which is tremendous.
Yep.
And when we look, we say, hey, you're not just 98% strength, which you were, but you were, just a ton stronger on both sides, which we know is protective. And then I'm even going to look at, what your leg press numbers were. Um, there we were at 335 on your previous surgical side, right? And 275
Yep.
when we first test, and those both went up to 360 on both sides. So just a tremendous growth and a tremendous improvement for someone who went from not really a gym person to becoming not just a gym person, but someone who's stronger, more confident, on both knees. Talk a little bit about, because I think this is a really important thing of like, you're someone who, listening to your story from the outside and way you described your non-operative or your first surgery, right? Going through that, it sounds like, hey, you found a really good local clinic. You were strength tested. They worked with your schedule. You were a good athlete. You met all your milestones. You ran a half marathon. Um, but it obviously was something that you felt like this was different. Why do you feel like, hey, having now gone through both things, you found more success with us, despite having what anyone from the outside would say is almost a dream in-person session-based scenario? Because I think that's what a lot of people find is like, well, I just need to find my local ACL expert. Yeah, talk a little bit about that.
Yeah, think it was two things. Like, number one, we talked about the fact that I didn't strengthen my non-operative side while I was in there. So I think that was like a big ding, in that program. And that was like actively like losing strength. So I was probably like a little bit weaker than probably when even before I started, I didn't really have like baseline numbers. And it's also like hard, like even like in that session-based model to get like enough like meaningful time, like on like all of the machines and everything to actually be able to gain strength. Because you're doing like a lot of other things, like during like that same session, like you're trying to get as you progress through, like you're still doing your strength stuff, but you're trying to get like plyos and everything in, and like kind of like your sport specific training as well. So it's a lot to cram into that time period, even if you have a lenient physical therapist.
Yeah. No,
And
that, go
oh, go
ahead.
ahead.
I was just going to say, and I want to highlight again, you talking about earlier saying, hey, I was spending 3 hours in those sessions, 2 hours, 45 minutes in those sessions, and not training your non surgical side, right?
Yeah.
You weren't, because it wasn't custom, you weren't left the time to train your non surgical side because you were spending so much time going through
Yes.
the full protocol.
It
And I
was
think
like
that's a
jam
key.
packed. I was so tired, like by the end of like every session. And again, like if you like the same thing with that session, like there's not flexibility. Like my days were like Monday, Wednesday, and Friday. And if I wasn't feeling good on Friday, if I was still sore from Wednesday, like guess what? I'm still going on Friday and showing up for my session, and nothing's going to be different. Whereas like with Tommy's program, like you have like that flexibility, like you see like your global picture of like the week ahead. And if you're not feeling good on Friday, if you still need another day to rest, then you can either talk to Tommy and get things switched up, or pushed on to Saturday when you've had like more time to rest. So I think you end up getting like more beneficial, more meaningful strength, being able like having like those appropriate rest periods built in.
Yeah.
And then when I graduated from PT, I wasn't given a program like for maintenance or anything either. I was just kind of like turned loose. And then like the pandemic started, so I was just kind of like wandering for like 4 or 5 months, like without like really having like a program, and like trying to remember like back then, like did she tell me something? Was I given something? Like nothing was specific, nothing was in writing. So I really didn't know like what I was supposed to what I was supposed to do like to maintain myself.
Yeah.
Yeah. Whereas like after I finished up with Tommy, like he gave me like very specific criteria, what I'd be doing like a couple times a week to maintain the strength I built.
Yeah. No, 100%. And I think that's so key again because people view this as like I have my PT exercises sometimes, right? And that's what you get when you go in person a lot is you're doing your band walks, your leg lifts, and then that gets left behind, right? And rightfully so, right? Because you shouldn't need to maintain those forever. But having this blend in with strength and conditioning, and that's really what we want and what people need is a true strength and conditioning progression that is aware of the rehab principles that are needed to protect is really what's needed for progress. Talk a little bit about how, because I think exactly like you said about how you felt like we were getting more kind of in the trenches with you and more personalized, despite obviously not being with you in person. Talk a little bit about how you felt that was like we were able to do that through the kind of communication we had. And I think one thing that we when we look at is like you said when you go through this rehab, there's illnesses that pop
Mhm.
up. There's returning to work, and you have a job where you might be on your feet sometimes, right? And a lot of people have that. You have returning to travel and different things like that. Talk a little bit about how this kind of was allow us to kind of get in the trenches with you and in your life.
Yeah. So, first of all, like you've got communication that via WhatsApp with Tommy, and now I understand you've got more people on your team now too. It's
Hmm.
probably even more communication than what we had before. But within most days, as long as it wasn't a weekend, like within hours, if not within like the next hour, that I would like hear a response from you if like something really acute like was going on, and we had to kind of talk through it. And we've got like our weekly check-ins and everything too, where you do like a really thorough review like of the week and everything, what went well, like our problems that arose like during the week. So a couple times, like specific times I can think of like that where we modified our program. First is that I developed patellar tendonitis like pretty early on, like in the program, and actually we had to delay my strength testing because of the tendonitis that I had. So it really changed my program like for a couple weeks while I was kind of getting like through that phase of tendonitis. Eventually I got through it, but things like really kind of had to change. We had to like lower the load, kind of walk me back a little bit before I could like go forward on that. And then around like that same time, took a week-long trip to Disney too. So I had, getting like 10, 15, 20,000 steps a day, like while I was at Disney. And I had my program and everything like for mobility while I was at Disney. And like I couldn't have imagined like being able to go. I was on like 4 months post-op. But you got me there. And I handled like the load like pretty well because like we had kind of already been gradually increasing my load in preparation like for this trip.
Yeah.
And then like a couple other things like randomly sprained my ankle at some point like during rehab. So I kind of walked through that. So like things happen, especially over the course of like a 12 to 18 month long rehab. Like stuff like that will happen, and like you kind of need like that flexibility and everything. So Tommy's always there. You just have to be open and honest like about what's going on, so that stuff can be modified for you.
Yeah. No, that's a great point. And I'm glad you talked to that about that patella tendinopathy because I think that's an important thing too that we understand. Like, listen, I think sometimes when we talk to people is they end up having issues like that and train around them and are
Hmm.
able to progress and move forward. And it's like I still have this negative patella tendinopathy, but we progress through it. Versus we said, hey, we're going to take a step back. We're going to address this head on, treat that as
Hmm.
the rate limiting factor and progress you forward,
Yeah.
right? Instead of ingraining compensations and working around that. And I think that is really where sometimes people go from feeling like they're doing a good job and then suffer re-injury or suffer secondary injury or struggle with the progression because we want to make sure we treat it as that rate limiting factor and we don't say, hey, we're married to the progress. This is what we mapped out. We got to stick to it. We got to make sure we get you what's going on with you and what you need and understand that, hey, you only have so much load that your knee can handle at any given point. And if you're in Disney for a week and putting 20,000 steps on it a day, some of that load's being used
Hmm.
up, right? And that's not to say, oh my God, we operate in a lab. You can't execute on the program we put together. What are you going to do? It's like, hey, we understand life happens. You're traveling. You want to still be able to live your life this year. We adapt. We keep you moving forward to make sure you keep feeling good. And we're able to keep you, on path to progress. And I think that's really key. And
Yeah,
one of the biggest things we talk about was starting early in terms of making sure those little hiccups that pop up don't become massive setbacks. They become bumps in the road, right?
right.
Talk a little bit about, I know you said, starting 6 weeks post-op and almost wishing you started a little bit earlier. When you first started with us, really, the only people who started early with us were professional, semi-professional athletes, um, were healthcare workers, so doctors, nurses, pharmacists, PTs, PAs, people who understand some limits of traditional care, and people who've been through this injury once before, as you had, right? And
Yep.
kind of were trusted the process, went through the things, and then they suffered a re-injury or secondary injury, and they're like, I'm going to make sure I do this right from day one. As we've grown, we have more and more people who start with us in the early phases because they've been through or they've seen others experience, they've learned from others' experience. That's really what we want, so that we can help people feel like, hey, this is just a bump in the road for them. And we're not spending time undoing cycles of issues that have been created. Talk a little bit about the importance of starting early and starting in those early phases and what that meant to you.
Yeah. So I think it's important to start early because you don't realize like how deep of a hole that you're digging until like you actually like start like truly like getting like assessed like by an ACL expert. Because you can dig like a pretty deep hole and make lots of compensations and pick up lots of bad habits, and it's just gonna end up like you're gonna spend up more time like digging yourself out of that hole versus like if you hadn't started like digging in the first place and just started on the right program like from day one. Um, so yeah, I think that's the big reason like for starting early, and then each day like that you're not like doing appropriate strengthening and everything is a day like that you're missing out and you're losing muscle. So
No, I think that's a great point. It's something that's really important. One of the things we talked about with you, and like, hey, and I think this is good for ACLs to hear of, like, in a sense, we moved slower. You moved slower with us, right? If you were not comparing it, if you weren't saying, hey, I'd been through that before and it didn't work out for me, if you were yourself on the second injury comparing to a friend going through the first injury, you'd be like, shit, she's beating me, right? You would be like, she's running a half marathon at 7 months post-op. She's,
yeah,
jumping and running earlier than
yeah,
me. She's doing all these things earlier than me. And you'd feel, downright, like bad,
yeah.
and I think,
With you, I
but
wasn't even running until like 8 months post-op.
right,
It's like really
right.
because I was running a half marathon at this point,
Right,
my
right,
first rehab.
right, and that's I think that's one of the keys. We really treated that knee as the rate limiting
Yeah.
factor, and what we decided was to take, obviously, hey, we're going to naturally move a little bit slower, knowing this is your second injury, right? And knowing where you started and some of the things, potential compensations you had in the first time, but I think the key is that we went for a more complete recovery, and I think that's where. Talk a little bit about, did you find that hard, and maybe even just a paradigm shift of what your goal was, maybe in the first one feeling like, because I think that's something for ACLers to recognize, that I think a lot of times people think winning this rehab is moving more quickly, but it's really the completeness that you want. Talk a little bit about that.
Um, Yeah, honestly, like my first rehab, like I just wanted to get done with it. They said like 9 to 12 months, and like I always like to be ahead of the game and everything. So I was like, okay, cool. I'm going to try to finish in 9 months then and do this like as quickly as possible.
Mm,
Whereas like with the second rehab, it's like I realized that faster is like not necessarily better. And like I did see like there's plenty of areas where I said like I'm not comfortable with this. Like I need more time, especially like
mm,
when it came like to my jumping progression. I think you had it in there like program like that I was going to do like a 12-inch box jump.
yeah,
And I was like, no way, like we're
yeah,
not doing this on my first one.
yeah,
So I did like a 4-inch one or something like to start off with. So like my jumping progression I know because I was never a confident jumper before. Like we took that very, very slowly,
yeah,
like until I was able to confidently jump. And I was like it was the first time I was ever confident in jumping, was during like rehab with you, Tommy.
yeah.
And last week actually I signed up for my first parkour class,
Let's go.
which is
Oh, yes.
crazy. if you had known me like 5 years ago, like you would say like there's no way this girl's ever like doing parkour, but I was jumping
Yeah.
off of walls and so
Yes, I love
it was
that.
so much fun.
Yeah. No, I love that. And I think that that brings me to really kind of one of the last things I really want to talk about, which is really just your where you're at. And I think, I'm going to summarize it a little bit, but then I really want
Yeah.
you to just talk about your experience and or your of feelings of where you're at now and kind of more just, not just what you're doing, but the feelings you have. Because I think that's something that you're in medicine, right? And you talk about what people talk about a lot in traditional PT is what are your functional goals, right? And your functional goals are first, to be able to go up and down stairs in your house and to be able to, do XYZ. But then it's like, okay, pick three, okay, I want to get back to soccer. I want to get back to martial arts. But I think someone like you and someone like pretty much all of our all NACL clients are like, I want to get back to being able to say yes. I want to be able to have confidence in my leg and do whatever I want, right? And we knew, getting back, testing for your black belt, that was a defined goal, right? Being confident enough to compete. But parkour wasn't a goal, right? But it was like, hey, we want you to really be
Yeah.
confident in this leg and really be able to land awkwardly and feel confident in it, to go for a run and step off curb and feel like, hey, this knee is really going to support me. And that was the route we take. Talk a little bit about kind of just where you're at now in terms of what you feel, what you've achieved, from competing again to, black belt to receiving your black belt to parkour classes and just, how you feel kind of in general about your knee and where you're at.
Yeah, so I started transitioning like back to karate while I was still with Tommy for a couple months. We kind of had like an overlap transition phase. And then I started going back to karate, getting back into sparring and everything. And I did take it like a little bit slow as I kind of like built up like my conditioning and getting back into it. But then it was actually on the anniversary of my first ACL injury, I went ahead and I tested for my first degree black belt in karate, and it was a 3-day test. I was able to pass the test, so ended up earning my first degree black belt.
Yeah, yeah,
Looking at getting back into competing here pretty soon, but my primary focus was just focusing on that black belt. And the only reason that like I kind of delayed going back was because my legs were strong, but I was having a hard time passing my push-up test. So like I dedicated a few months to being able to do my push-ups and everything. That's literally the only thing holding me back was that I couldn't do all my
yeah,
push-ups.
yeah.
Yeah, but everything else, like leg-wise and everything, I was doing great. Passed my running test, all that stuff.
Yeah, that's incredible. And yeah, I think really the thing I want to highlight more than anything, because I think you're such a good example to so many ACLers out there of like what a real successful recovery looks like, and what how when you are a good athlete, when you're when you've played sports, when you've been an athlete your whole life, how you're able to compensate, and how you're able to get by and do things right, and have what seems like a model recovery. But if you're not getting everything you need, I think this is where going down the right path and understanding it and understanding how to attack it, right? I think that's what you said that makes me so happy is like, okay, now it's easy to look back on and say, hey, we did it right, right? The second
Hmm.
time was better than the first time. But I think most important was you said that first conversation we had of like seeing that path. That's what I want everyone to see. And is if you don't feel like you see that path, I think that's where if you don't have clarity in terms of this is how I'm going to get from point A to point Z, I think that is really what you need to say is because what you need to say is not because I don't think anything about your recovery the first time was a red flag, right? What I always try to say is this is a very hard recovery, right? And some of those statistics are stacked against you where sometimes the enemy of great is not bad, but it's good, right? Where if you're just getting
Hmm.
decent enough rehab, you're like, I'll just stick with this, right? But
Right.
what we did differently was you understood the criteria, you understood the steps we were taking, you understand how we were attacking this, what the goals were, and what the progress was going to be each and every week. And I think that's so key to success in this. And I'm so appreciative of all the work you put in and all you've done to share your story and help us grow. As you said, it's crazy to think back that you're 2022 when you started, and it's just been we've grown immensely since then because of people like you sharing their story, and I'm super grateful for that. So I appreciate you coming on. And anything else you want to say before we hop off?
think we just about covered it. Like I said, I love talking about knees. I'm the knee girl, so always happy to get on here and talk about knees for an hour or so.
Yeah.
Usually don't have an audience that's willing to listen to me for this long, so
I love
yeah,
that. I love it. And this is the last thing I want to say because you're a pharmacist, and this is one of my favorite expressions, and I didn't say it earlier, and I just didn't. Well, the reason we love this program, and as a pharmacist, you'll know it's not just the thing that makes the medication is the dosages and the interaction, right? And that's what's so key. And I think that is why a pharmacist is so important, right? Because they're going to understand the dosages you need and the interaction, not just what medication to take. And I think a lot of times when we talk to people, it's like, I'm doing this exercise, I'm doing this exercise. And it's like somewhere in there are all the right exercises most of the time, right?
yeah,
But it's the dosage and the interaction of how do they interact with your Disney trip, or how do they interact with you being on your feet a lot at work? And how do they interact with the other exercises you're doing? And then how do we dose them, right? The volume and the intensity across the week. And I think that is really critically important, and again, why this model worked for you in a way that sessions, even really good sessions, maybe didn't. So,
yeah. No, I
so
love that
appreciate,
analogy.
yeah, I so appreciate you joining me. And I'll look for that first competition. Will be awesome to see. If you're ever looking for sponsors, let us know. We're always happy to sponsor athletes. So we appreciate it.
Well, thanks, Tommy. Thanks for having me on.
Absolutely. I'll talk to you soon, Stacy.
Okay, bye.
Bye.